Hello, everyone. My name is Leah Mushet. I'm a reporter here at the Western Standard, and today I have a guest named Alexander Raikin. He is a visiting fellow in the Bioethics, Technology, and Human Flourishing Program at the Ethics and Public Policy Center. He focuses his research on dignity of human life and end-of-life issues, which also is related to our topic today, which is MAID. He's done a few investigative pieces on this issue, and I thought it was very relevant considering in the news the past month, there has been a case where a 38-year-old Canadian man was euthanized, and his heart was donated to a 59-year-old American man. So this is also relevant because you're also based in the U.S. right now in Washington. But anyways, my first question to you is, in your investigative work, you were talking a lot about how lots of when there's been lots of non-compliance issues by medical practitioners in MAID, especially in Ontario, in Quebec. At least there's been basically like audits on the topic of this. So why don't you tell us a little bit how these medical professionals haven't been following criminal law in regards to
Yeah. Yeah, I mean, that's a great question. Though I would also say, having grown up in Canada, I also feel that my heart is in Canada, even though I'm working in the US. But this is pretty grim. Well, to start out with, in theory, Canada should have one of the strictest laws on euthanasia because it's written in our criminal code, right? So it's in the Criminal Code of Canada that MAID is theoretically regulated and legalized. The issues is that sometimes those legal safeguards are not being followed by practitioners. So I wrote a report that looked in Ontario. The Chief Coroner of Ontario found somewhere around that 1 in 4 MAID providers were failing to follow some sort of regulation or law. In Quebec, we know that there are, as of now, there have been hundreds of cases where MAID practitioners failed to follow the law. And in fact, every single annual report since, I believe, something like 2022, in Quebec, by Quebec's independent commission that audits these sort of MAID reports that you were talking about, they actually invented a new category of underlying illness that qualifies for MAID, which is, to wit, no illness that qualifies under Quebec's law, right? So they're literally recording under, when they're detailing patients who died from an underlying illness with cancer, with different types of cancers, with ALS, and then there's also a reporting category of no illness that would qualify under Quebec's provincial law, right? And this is the official provincial reporting. So I think that should tell you sort of A, the scale, and B, the extent that this is happening. And the fact also of that there's pretty much no real consequences for medical practitioners who violate the criminal code in Canada.
Yeah, that's actually insane, because if they're violating the criminal code, like, why aren't they receiving any punishment? But in that regards, so they're violating the law and they've been audited by, I don't recall the names of the people who were auditing them, but in those cases, did you read any statements by the two men, the Ontario person and the Quebec person, saying like these people should be punished in some way, they should be at least reprimanded, or we should introduce these new standards, like anything like that?
So the problem is okay. The problem is really with the prosecutors in those provinces, and the problems with the Minister of Justice in those provinces. So, for instance, the independent commission, so it's Commission sur les soins de fin de vie, or Commission on End of Life, in Quebec. That commission doesn't have any powers on its own to discipline anyone, right? All that they're doing is that they're looking at the chart reviews of different MAID devs, and then they're determining if those MAID devs followed the law or didn't follow the law. Then they're sending those out to every single case to the Quebec's College of Health, Quebec's College of Physicians. And then the Quebec's College of Physicians has then the ability to then further send those on to the police. The issue is that the Quebec's College of Physicians, even in those cases where the people who died under MAID did not have an illness that would qualify under Quebec's law and under the federal law on MAID, even in those cases, the Quebec's College of Physicians has refused to really entertain any serious investigation. I also reported earlier that there was a physician who was, who warned about the cases of, or who cautioned against legalizing MAID for people with dementia. And he testified this in Parliament, right? So in Ottawa. And the Quebec's College of Physicians' response was to investigate him for spreading misinformation. Okay, so they're investigating the completely wrong people, and in that case, it was completely, they found that he committed nothing untoward, considering he was testifying to a parliamentary committee. And this is also, I should also say, the Quebec's College of Physicians is also the same college that was urging Parliament to expand euthanasia to neonates, right, to infants. Which Inclusion Canada, which is one of the leading disability organizations in Canada for children and adults with intellectual disabilities, refer to that as simply murder. Wow. But that's on Quebec's side. On Ontario's side, I can't really explain. The Chief Coroner of Ontario, he has not sent a single case to the police to investigate. The coroner has. The provincial coroner in Ontario has a lot of powers that you could use to actually investigate some of these cases. And we know that, if you do not follow the exact detailed safeguards and eligibility criteria under Canada's federal law, that you are breaking a criminal law. Whatever reason, the Chief Coroner of Ontario has not really done anything about that. And in fact, he's been and this is a problem that's been going on for many, many years. The last public statement that the Chief Coroner of Ontario made was a letter to every single Ontario healthcare practitioner warning of repeated compliance concerns with MAID, with MAID providers, not following the criminal code, right? So he was referring to violations, compliance concerns with the criminal code. In a healthy, normal society, that would raise red flags. And after the Chief Coroner of Ontario warned about this, that was the last public statement, but then he made many, many other statements internally to physicians and nurses, including MAID providers, that exact same problem has continued over the years, and in many ways has actually expanded, with the number of violations rising quite precipitously. And yet there's been nothing, right? There's been nothing that was done. One of the results of actually my reporting on this, sorry, you have to laugh because it's so absurd, was that I sent a question to the Chief Coroner of Ontario, and I should also mention it's been the same Chief Coroner, I believe, since MAID has been legalized. I think he was on that job, which was 2015, where it was effectively decriminalized in 2016 when it was legalized. But I sent an email, asking him about these issues and what he was thinking about it. I also mentioned that under his office's interpretation of the federal rules, that if there was a minor who was euthanized, that according to the consequences that he reported, that he would not refer to that case to the police, right? So in that hypothetical situation of a minor being euthanized.
Oh my God.
I asked him, why is that? And his response was, on second thought, I would actually report that to the police. So he did update that on the provincial. I think that kind of tells you everything, right? Like under Canada, in the criminal code, right, it explicitly says, it explicitly states different eligibility criteria, right? So you need to have a qualifying illness or disability. You need to be over the age of 18. It needs to be in an advanced state of decline, right? And there's other eligibility criteria and safeguards or theoretical safeguards, I should say, that are part of all this. And if you think that a minor being euthanized is not something that you would immediately report to the police, as not only as a healthcare practitioner, but as a public bureaucrat, what are we even doing here? And I think it explains a lot of this. There was another case that I also reported on, which was the Chief Coroner of Ontario describing a blatant case where a MAID provider just blatantly didn't follow the law. I mean, in that case, according to the Chief Coroner of Ontario, the MAID provider didn't even know any of the rules associated, and she didn't know what the protocol was. She used the wrong medication. According to Chief Coroner's office, or according to Chief Coroner of Ontario, the patient and the family suffered tremendously from that. It was definitely not a quote-unquote dignified death. And the response to that blatant violation was not even a license suspension, right? So this physician is still practicing medicine in Ontario. Last time I checked, she was only not allowed to practice palliative care unless she was supervised, and she was not allowed to provide assessments or to perform euthanasia. But think what this means, right? If you don't even know any of the safeguards, right, and you essentially torture a patient with just providing whatever ad hoc medical supplies you have that you believe will kill the patient, and the response to quite blatantly, according to Chief Coroner of Ontario, is causing suffering to the patient and the family. And the response to that is that you can still remain a physician in good standing in Ontario. I mean, it shows that the criminal safeguards aren't worth anything. They're not being enforced. They're not being followed. And patients and family members are suffering tremendously from it.
Yeah. Wow. Yeah. Like, from all that you've said so far, it just makes me think, like, is there like incentives for people to like have like a certain number of like MAID patients?
Yeah, I mean, it's fee by service, like anything else in medicine, right? So, or fee per service, excuse me. So yeah, I mean, there's really, if you're being paid by the MAID assessment and you're being paid by the MAID provision, we know that, look, the vast majority of physicians and nurses in Canada do not want to do anything with MAID, right? They do not provide assessments. They do not do MAID provisions. People who do MAID assessments and MAID provisions, there are a very small percentage of Canada's total physicians and nurse practitioners. And for some of them, a disproportionate few, that is their primary way of making money. And that is their primary medical, specialization. So we have in Canada MAID physicians who have provided hundreds of cases. I believe in Ontario, I believe in Ontario there was there was one MAID provider who in 2023 performed almost one MAID provision every single working day. So I mean, you have a select few who have done hundreds, if not thousands by now, MAID provisions, right? And MAID provisions is, let's not be coy about what the language means, right? It is explicitly ending the life of the patient through lethal injection, right? Like this sugar coating of language, I feel, is part of the problem. And I'll also just say one last thing about this, is that in the US, there's a whole scandal over lethal injection of prisoners, right? That this is inhumane, that it is not a dignified death, et cetera, et cetera. Well, the US struggles to perform something like 10 capital punishments, executions a year. Whereas in Canada, we're now nearing at almost over 15,000 MAID deaths a year. So we're talking about a massive number of what are effectively lethal injections. And there's been surprisingly little interest in the media about what that actually entails. And what I worry is that a lot of it, on a second look, looks a lot closer to the American experience, rather than a sort of dignified death that proponents are talking about.
Yeah, that's literally when you were talking and stuff, I'm like, yeah, it doesn't make any sense. Like, why hasn't there been more attention on this? Obviously you've done good work on it. But like, yeah, I even remember like the case I mentioned earlier, the 38-year-old man who got euthanized. I know it's not exactly like there wasn't evidence that there was non-compliance or whatever, but the fact that that happened as well, I just think there wasn't that much media coverage, especially in Canada, for it. So yeah,
And
but
I should also say, just on that, Canada is leading the world in organ donations post MAID. What one of the reasons for that is, again, it is so absurd. It's very difficult to understand how we got to this point, because the original guidelines in Canada, when MAID was first legalized, was that organ donations would only be possible, like soliciting for organ donations would only be possible after someone is already fully approved for MAID. This is the procedure in the Netherlands, for instance, right? That organ donations are only possible once someone is approved for MAID, because if you offer organ donations as a pathway, especially if someone is struggling with depression, especially if someone has a serious illness at the same time, that would be very difficult for them to choose in sort of unbiased, uncoerced way to donate their organs. That is, I think that you ask a random person on the street, I think most people, and especially most medical practitioners, would support that policy. The issue is that Canada became the first jurisdiction in the world to recommend MAID providers to offer organ donations even before someone is fully approved for MAID, right? So it is policy to offer organ donations for people who are applying for MAID after only their first approval by the first MAID provider or assessor. Right. And as part of the legal process is you still have to go for a second assessor. But instead of waiting for that process to finish, right, it's literally in the MAID process itself, right? The person hasn't been fully approved for MAID, which is to say they haven't been approved for MAID. They're being asked about organ donations if they otherwise qualify therapeutically for that. So this is, this is crazy. In my humble opinion,
yeah,
that explains a lot of the sort of just the massive expansion in MAID and MAID organ donations.
No, like it is crazy, and I guess I have another question for you. So, since you said like Canada is the first country to like offer it before even they have decided that they are a candidate for MAID, I'm just thinking, is this just a consequence of just even allowing like these provisions to even have MAID? Is there even a way to regulate this so none of this would happen, or are we so far gone that it's just like you can't do anything about, like, it's just, I don't know, it just seems so corrupt that, yeah, that's my question.
No, I think that's an excellent question. And my personal opinions, my personal opinion is I don't think it's possible to regulate a safe practice of an assisted death. I think that when the role of a healer is being corrupted into the role of a killer, no matter how you couch that language, it ultimately leads to dangerous consequences, like what we're seeing right now in Canada. Canada's MAID program. That said, Canada's MAID program is especially it goes above and beyond of the normal problems with assisted dying. Canada's MAID program is almost a pariah on an international stage. The state of New York, which just recently voted in the state Senate to legalize assisted suicide. One of the reasons that it passed on a very narrow vote was because the proponents of that bill specified that their assisted suicide bill would look nothing like Canada's. In the UK, there was also another close vote. Proponents had to distance themselves from Canada's euthanasia program, even though at the beginning, they actually supported Canada's euthanasia program. So we're really talking about a program that is internationally viewed as a system not working. And look, the reason that assisted suicide and euthanasia are legal in Canada is because the Supreme Court of Canada, after barely 20 years after it, in the Rodriguez case, when it said that there was not a constitutional right for euthanasia, then changed its mind and then unanimously said there all of a sudden is a right for euthanasia. I think the logic of that is very flawed and it's very weak, and it definitely has not been held up by Canada's example. But that is why it is legal in Canada. Canada's parliament voted many, many, many times, I think close to a dozen times against legalizing this prior to the Supreme Court case. So all of that said, it is still possible to have basic common sense safeguards. Right now there's a bill. There's a bill that's that was proposed in Parliament to stop Canada's expansion of MAID purely for mental illness. If this bill doesn't pass, then in 2027, I believe, Canada is going to expand euthanasia to include people whose only diagnosed conditions will be things like depression. So I think that is a very commonsensical safeguard that can be implemented now. And I don't want to go on and on. But I do worry tremendously about where Canada's going. MAID, now I wrote another report that MAID in Canada is now the 5th most common cause of death.
Holy crap.
And it's going to, and I think that's only going to increase over time. I think the issues are another sort of statistic that that's hard to grapple. Do you know how long the wait time is to get the median wait time to get a CT scan in Canada?
No, unfortunately or fortunately, yeah.
Yeah, that's fortunate, but it's around 40 days. Okay, so it's around 40 days. This
40
is
days.
not this isn't an elective procedure, right? Like this is a priority procedure. No one goes to their family physician and says, I really want a CT scan.
Right. Yeah.
This is this is one of the, this has to be recommended to you by your physician, and they have to file that in. Okay. The median wait time in 2023 to tell orally your physician or nurse practitioner that you want to die for MAID, get the paperwork, complete the paperwork, find the witnesses for it, find your first MAID assessor, which either has to be a physician or nurse practitioner, find your second MAID assessor, which has to be a physician or a nurse practitioner, get those appointments, go through those meetings, get approved by both of them, finalize your end of life plans, schedule your death, schedule your funeral, schedule your final end of life matters, and then go to that your MAID procedure and die. That entire process, the median number of days to complete that from request to death through MAID in 2023 was only 13 days.
Oh my God. Less than 2 weeks.
Less than 2 weeks,
Wow.
right? Versus the median wait time for a CT scan, right? So 50% of people have a longer wait time for that. To get a CT scan, right, it is more than a month, right? Like this is where we're at. And I think that Canada's healthcare system is massively struggling. The past head of the Canadian Medical Association described Canada's healthcare system as undergoing a collapse. We're the only country in the world with a public healthcare system that has no private option whatsoever. Right? It is against law to sell your service as a physician if there's a public health option. Canada's healthcare system is massively strained. And yet, the one medical procedure that seems to be fully funded is the medical procedure that would end your life. It's a medical procedure that could also be used to help you become an organ donor when you otherwise are potentially not able to.
Mm-hmm.
If you're someone with a serious illness, it will be unethical for you to donate an organ, right? If your body can't handle the strain. But if you're at first, well, then it's almost unethical, right? So it wasn't that long ago, right? Like what was it, in 2016, right? When Bernie Sanders was talking about Canada's healthcare system as something to be emulated in the US, right?
Mm-hmm.
I don't think any US are making that argument right now.
Wow. Okay. Well, that's like literally so. There's so much I didn't know that now I know, and it's just really wild, and it's probably even more corrupt than I thought it was. So, thank you very much, Alexander. I really appreciate you coming on, and yeah, you had a bunch of great information. So I think lots of people are gonna learn a lot from this. So thank you.
Likewise. Thank you, Leah.
Thanks. Okay. Well, if you guys enjoyed this video and you feel like you've been informed, you can also check out our website, which is westernstandard.news. It's $10 a month and $100 a year. And you can subscribe to our YouTube channel for more content like this. So that's all I have to say. And thank you for joining us today, and goodbye.